You can gain fascinating information out of good registries, and we have some great ones that the NCDR oversees, including the Impact Registry. And I'm with Dr. Robert Vincent, Children's Healthcare, Emory University, Atlanta, Georgia, and we're talking about the Impact Registry. Okay, first off, what is it?
Impact stands for Improving Pediatric and Adult Congenital Treatment. It's really a cath registry put together for all pediatric patients undergoing cardiac catheterization and adult congenital patients. Like all NCDR registries, it's a voluntary registry. Hospitals choose whether or not they want to participate, and we've been extremely pleased with the participation we've seen so far. Since we put the registry together and opened it up for a trial in late 2010, really we start 2011, we're now up to 70 sites, and we're estimating there may be only 120 to 150 sites out there who would participate.
The ACC, and I think it was NCDR, recently did a survey, and they found that something like 99% of respondents want more education regarding adult congenital heart disease management. So there's definitely a need for information. What have you learned from Impact?
Well, we're just starting to look at the data we've accumulated over the last couple of years. Most of what we've learned so far is in the pediatric age group. We do break out the adult age group in terms of catheterization, and I don't think there are going to be any major surprises there in terms of the complications and death rate associated with adult congenital CAS. They're still pretty low. Most of the things that we're seeing, the problems, are going to be in the pediatric side. On the other hand, the devices that were being used, we're going to have a much better handle on what's happening in the adult world than we do now.
So there are 4 papers here, 4 Impact papers, posters being presented.
That's correct. We based our posters on the metrics around what we're doing. The poster that I'm presented yesterday, was basically on diagnostic cath and the metrics associated with those, which are adverse events and death associated with diagnostic cath. We have 6 modules within Impact looking at specific therapies for congenital pulmonary and aortic valve stenosis, coarctation, stents, and pulmonary artery stents, PDA and ASD closures. And those together combine another 3 posters headed up by John Moore.
So what are you finding in terms of how much data there is to glean, because there is 1.3 million, I think, people with adult congenital heart disease in the United States?
Yeah. Well, honestly, right now, Impact is in its infancy. We're just starting. We're starting to understand the data that we're seeing. We're getting a handle on what's being done. First of all, we had no idea on what was being done before. We're getting a handle on the complications. And it's going to take a few years right now until we can really put it together and answer some questions meaningfully.
But this is the time to join the registry?
It is absolutely the time to join the registry. You know, the more data we have, the more people submitting patients, and we're really looking for low volume sites as well as high volume sites. It's not, we don't want just the best of the best, or people who consider themselves the best of the best to put in data. We want this to reflect everything that's happening across the country.
Real world data.
Real world data, and in fact we have an international site in Canada as well.
Would you do me a favor and give us an idea how to contact the registry online?
Well, if you just go to NCDR, you look at Impact, there's contact there, as there are for all the registries. Joan Michaels, joan.michaels@acc.org is the ACC representative for Impact, and she'll be very happy to answer any question and get you set up with being able to join the registry.
Terrific. Thank you very much for your time.
Thank you.
And for other news from the ACC 13 meeting here in San Francisco, please join us in CardioSource World News. I'm Executive Editor Rick McGuire.